This video is an extension of my catheter insertion video, but in this video, we're going to be doing catheter care. We're going to be performing catheter care on a male patient, and the supplies that I would need are, I got a set of gloves, washcloth. Uh, I don't have a basin of soap and water, but we're going to play like we have a basin of soap and water here. Uh, and any other supplies you may think you need. But for right now, the main things that you're going to need is gloves, towel, soap and water, and yes, you're gonna need a another catheter secure device. Because sometimes when you do catheter care, the catheter secure device will get wet, and then it won't stick to the skin properly, so you have to change it out. So just keep one of those on hand just in case. The first thing that we're gonna do is we're gonna go in and talk to the patient. First thing we're going to do, identify the patient by name, date, and armband. And once we get that identified, we're going to inform the patient that the doctor has put in orders for catheter care. Catheter care usually is performed, especially with patients who are incontinent bottom bladder. We usually do catheter care every diaper change, or with those who are able to do so, take care of themselves. We can actually teach them how to do catheter care, and they are able to do it themselves. But for this video purpose, we're going to do it on the patient who's incontinent bottom bladder, and we're going to perform catheter care for them. So the first thing we're going to do after we have got everything identified, discuss the procedure. What we're going to do now, we're going to go hand hygiene, clean our hands up, get them soaked down, cleaned up, dried properly. After that, we're going to don a set of non-sterile gloves. Catheter care is not a sterile procedure, so non-sterile gloves will be just fine for this procedure. Okay, once we got the sterile gloves, what we're going to do is we're going to coach the patient. If they are alert and oriented, but again, bedbound, we're going to coach them and tell them exactly what we're going to explain it to them step by step as we're going. So the first thing I'm going to do is use my left hand, which is dependent on the left hand side, which is my non-dominant hand, and I'm going to take it, and if he's uncircumcised, we're going to retract the foreskin to expose the meatus. The second thing we're going to do, we're going to take a towel, soap and water, and what we're going to do is we're going to clean around the meatus, clean, dip it back in the water, dry it off, and we're going to clean down the shaft of the penis. All right. Get that clean. Once we got that clean, we're going to take a dry towel. We'll take a dry towel that we have on hand, and we're going to dry around the shaft and around the meatus part of it. Once we get that dried, next thing we're going to do, we're going to clean the catheter. So what we're going to do, we're going to hold pressure here right at the meatus area, and we're going to hold pressure on the catheter to make sure that while we perform the catheter care, we don't accidentally pull it out of place and lodge it into the urethra. And that is very painful for the patient. So while we holding pressure here, we take another towel that we have on hand, dip it in soap and water. And what we're going to do is dry the water out and take it, and we're going to wipe from the meatus all the way down. Soap and water, dip it in soap and water. Again, we're going to wipe all the way down. Next thing we're going to do, we're going to take another dry towel that we have here, and we're going to dry, just in a dry towel, we're going to dry the tubing. But like I said, there's a good possibility that the secure device that the catheter was hooked up to, it's going to get wet. And that's just part of it. Sometimes it will and sometimes it won't. But me, every time I do catheter care, if I deem it necessary or the securing device is sore, I will change it out. I would say I change it probably once every day. So what I would do is once I got all this clean, taking another time, make sure everything is dry from the catheter down the penis down the shaft for the penis. Everything is dry. Now we're gonna go to the catheter securing device, and if it is sore, if it ain't sore, okay, we can just go ahead secure it right back down. But if it is, what I like to do to make it a clean come off with the securing device, and take a little water and damp it over the securing device, and that will allow the sticky area under the tape to loosen. And once it's moist and loosened, I just slowly pull it off to make sure we don't get in the skin tears. After I pull it, dispose of it. Next thing I'm gonna do, I'm gonna take another dry towel. We're gonna dry that area. Make sure it is dry. And the next thing we're gonna do, once that area is completely dry, take the new securing device, apply it to the area of the skin that you wanted at, and then we're gonna take it and secure the catheter. And this ensures that the catheter doesn't pull and end up dislodged inside the urethra of the penis. Once all this is done, we just explain to the patient that the procedure is complete. What we do is take all our supplies that we use, dispose of them in the proper space, dirty linen in the garbage, dispose of the gloves. Next thing we're gonna do, hand hygiene. Go wash, clean up real good, make sure everything is clean. No filth under the hands and nails. Uh, Dry purposely. Make sure everything is completely dry. And the next thing after that, we're gonna document. We're gonna document under the hygiene part of the chart, saying you perform catheter care as ordered by the doctor. We didn't see any abnormalities. Polio is still patent and draining properly, with no pain at the insertion site. Uh, Once all of this is complete, we document how well the patient tolerated the procedure, and that'll be the end of the catheter care. Thank you.